Hey guys, and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by How to Gastro. And today's video is a very interesting and common topic, so let's get started. So in today's video, we'll explore the question, what are 10 causes for irregular periods? So every woman on this planet is different, and this includes the way we have our periods too. Some of us have periods like clockwork, whilst others of us have ones that are hit or miss and very unpredictable. On average, most women get their period every 24 to 38 days, and it usually lasts about 2 to 8 days each time. Many things can cause irregular, missed, or late periods, including changes in our body's level of the hormones estrogen and progesterone, which usually disrupt the normal pattern of our periods. This is why young girls going through puberty and older women approaching menopause most commonly suffer from irregular periods. So here are 10 possible causes for your irregular periods. Number 1 is stress. So when we're stressed, our body produces high levels of the stress hormone called cortisol. Cortisol can delay or even prevent ovulation. It also interferes with the body's production of progesterone, which in turn may even lead to spotting. So when we're stressed, our periods may show up late, early, or stop altogether, which is known as amenorrhea. High levels of cortisol could even cause heavier and more painful periods too. Number 2 is changes in appetite and weight. So there's no defined amount of weight gain that results in a missed period, but the more significant the weight gain and the more faster it happens, the more likely it is to affect your period. Both weight gain and weight loss can cause a delay in your period or even cause you to skip a period altogether. Your menstrual cycle is a result of a complex interaction between your ovaries and your brain. Changes in your hormonal levels cause ovulation, and more hormonal changes result in your period. Anything that interferes with this interaction, such as your caloric intake, can stop your body from ovulating. And if you don't ovulate, you'll end up skipping your period entirely. Number 3 is polycystic ovary syndrome. So in polycystic ovary syndrome, the ovaries make large amounts of androgens, which are actually male hormones. Small fluid-filled sacs called cysts then go on to develop in the ovaries. The hormonal changes, together with the cysts, then prevent eggs from maturing, and so ovulation may not take place consistently. Sometimes a woman with polycystic ovary syndrome will have irregular periods or stop menstruating completely. In addition, the condition is also associated with obesity, infertility, and hirsutism, which is excessive hair growth, and acne. Number 4 is pelvic inflammatory disease. So PID is a bacterial infection that affects the female reproductive system. Bacteria may enter the vagina via sexual contact and then spread to the uterus and upper genital tract. Bacteria may also enter the reproductive tract via gynecological procedures or through childbirth, miscarriage, or an abortion procedure. Symptoms of PID include heavy vaginal discharge with an unpleasant odor, irregular periods, pain in the pelvic and lower abdominal areas, fever, nausea, vomiting, and diarrhea. Number 5 is uterine polyps or fibroids. So uterine polyps are small, benign, non-cancerous growths in the lining of the uterus. They are tumors that attach to the wall of the uterus and may be one or several fibroids that range from as small as an apple seed to the size of a grapefruit. These tumors are usually benign, but they may also cause heavy bleeding and pain during periods too. Number 6 is endometriosis. So the endometrial tissue that lines the uterus breaks down every month and is discharged with the menstrual flow. Endometriosis occurs when the endometrial tissue starts to grow outside of the uterus. Often the endometrial tissue attaches itself to the ovaries or the fallopian tubes, and it sometimes even grows on the intestines or other organs in the lower digestive tract and in the area between the rectum and the uterus. Endometriosis may cause severe abnormal bleeding, cramps, or pain before and during periods, as well as painful intercourse. Number 7 is birth control pills. So most birth control pills contain a combination of the hormones estrogen and progestin, and some contain progestin alone. These pills prevent pregnancy by keeping the ovaries from releasing eggs. Going on or off birth control pills can affect menstruation. Some women have irregular or missed periods for up to 6 months after discontinuing the birth control pills, and this is an important consideration when you are planning on conception or becoming pregnant. Women who take birth control pills that contain progestin only may also suffer from bleeding between periods. Number 8 is uterine cancer or cervical cancer. So abnormal vaginal bleeding is the most common symptom of uterine and cervical cancers. Bleeding may start as a watery blood-streaked flow that may gradually contain more and more blood each time. The bleeding is also most common after intercourse, between menstrual periods, or after menopause. Most patients also report that their menstrual periods may be heavier and last longer than normal when tumors have invaded these areas. Number 9 is medications. So hormone replacement therapy, blood thinners, thyroid medications, epilepsy drugs, antidepressants, chemotherapy drugs, and aspirin and ibuprofen are some of the drug classes that can affect your period. Irregular periods whilst taking medications can include abnormal uterine bleeding, such as bleeding or spotting between periods, bleeding after sexual intercourse, and heavy bleeding during your period. Number 10 is excessive exercise. So missing your periods as a result of strenuous exercise is called exercise-induced amenorrhea. The combination of intense strenuous exercise and low caloric intake puts significant stress on the young female athlete's body. In response to this physiological stress, the hypothalamus turns down its stimulation of the ovaries. Chronic repeated exertion eventually leads to the cessation of ovulation along with the athlete's periods. And finally, one more cause, which is actually a bonus cause, which is an under or overactive thyroid gland. So hypothyroidism or an underactive thyroid gland is a disorder of insufficient thyroid hormone production. There are a number of menstrual irregularities associated with hypothyroidism, ranging from heavy, frequent menstrual bleeding to infrequent or even absent menstrual cycles. Sadly, absent or infrequent menses are also very common abnormalities seen with severe hyperthyroidism too. This is because an increase in the thyroid hormone indirectly causes an increase in the sex hormone binding globulin, which can prevent ovulation too. As with hypothyroidism, an overactive thyroid gland, which is hyperthyroidism, leads to scant or even missed periods and decreases fertility. In addition, excessive production of the thyroid hormone during pregnancy increases the patient's risk of a miscarriage. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notification so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care and thanks for joining me today as I explored the 10 causes for irregular periods.